joining me now is Dr. Paul Roumeltiotis, Medical Officer of Health with the Eastern Ontario Health Unit with a COVID-19 update. Welcome, Dr. Paul.
Good to be back.
All right, so doctor, since the weekend, I believe we went up about 7 cases in the region. Why don't you tell us a little bit about where we are right now?
Yeah, we're at 61 cases actually, and that's a slow increase. I'm actually happy about the rate at which the cases are growing. I know that we have cases all over Eastern Ontario, so the number of 60 really is 61 really is a representation of a very slow growth. Most of our cases occurred, if you look at if somebody goes to our website and looks at our graphs, they occurred more towards the middle of March, towards the ends of March. So now we're kind of seeing it go down. So we're hopefully going to keep that low level, because that means that people are listening to what we're talking about in terms of staying home, social distancing and so on. And we're also keeping an eye on, obviously we're still testing people, and those results are trickling in very slowly. Most of them are negative. The good news is that out of the 60 odd cases that we have, about 23 of them are totally resolved. Unfortunately, 3 are still in hospital in intensive care unit, but most were not hospitalized, which is a good news as well. But I'm happy to report these numbers because, again, they could have been much worse. We don't have any deaths in our area so far, which is I'm very happy about, and we want to continue this trend. So I want people to look at these numbers and say, it's still in our backyard, it's still here, but we're doing a good job, and we need to continue. We need to continue these measures another week or two. The good news also is that the number of cases in terms of Ontario, the way it's growing, is actually at a slower rate than it was last week and a week before. So that's good news too. So that means that we're actually likely or at the stage where we can say, it looks good that we're starting to flatten that curve, which means that we're decreasing the number of total daily cases to the point where it's not really overwhelming our hospitals. Our hospitals still have capacity. Our intensive care units across Ontario and in our area still have the capacity. And so our goal was to decrease the number of cases at once, and I think we're succeeding with that. And if you look at our curves, our curve at the health unit kind of flattens up around 60. You kind of see it going upwards, and then you could see that it kind of peaked in the middle of March. I'm hoping that we can continue those slow numbers. Those are manageable numbers. That means that what we're doing works. In other words, when we have a positive case, we're telling, because we know that one person can infect a couple. So what we're saying is, you've got a case, we monitor that individual. It's called contact tracing. One individual may have had 8 or 10 contacts. We monitor them, we keep them under isolation. So actually, collectively, we're doing, I think, a very good job being able to limit the number of cases in our area. But that doesn't mean we have to let up. We need to continue moving forward with these approaches until we see a real sign of flattening of that curve. At which point, because many people ask me, when are we going to start opening our schools? When are we going to start, going back to normal? Well, I can't tell you exactly, but I can tell you that now we're looking at those things and trying to say, okay, what's going to happen? What are the signs that we look for when we start saying, okay, now we'll reopen schools or slowly reopen businesses? The other thing that people ask me is, when is this going to happen? I can't tell you when this is going to happen, but I can tell you it's going to happen slowly. It's not going to happen one shot. It's going to happen progressively. And as we open one thing, we're going to keep an eye out on infections, at our hospital rates and so on, and then move forward.
Excellent. Well, Doctor, I'd like to thank you on that note for joining me for this update, and we'll continue to, of course, follow closely the numbers and see where we're at. So thank you, Doctor.
No problem.